For our lesson 8, we will be discussing about the health problems common in adolescent. Okay, when we talk about the adolescent, ito yung mga teenagers, okay, teenage years. Okay, for our first topic, we will be tackling about the scoliosis. Okay, for the scoliosis, it is a spinal deformity, okay, that is usually involves lateral curvature of the spine, spinal rotation, and then yung thoracic hypokyphosis. Okay, this is the most common spinal deformity. During adolescence, scoliosis is more common sa mga girls than in boys. Untreated scoliosis may lead to back pain. Okay, makakaramdam sila ng back pain, fatigue, mabilis mapagod. Okay, disability kasi may limitation sa mga activities nila because of the pain na mararamdaman nila, and also heart and lung complications. Sa heart na complication, this is due to the rib cage that push against the heart, causing difficulty of the increase the heart to pump blood around the body. Okay? Kapag lung complications naman, reduce the lung diaphragmatic, it reduces the lung volumes and limited diaphragmatic excursion and chest wall muscle inefficiency. So, yun yung magiging effect niya sa dalawang major organs natin, which is the heart and then the lungs. Okay, for the etiology, scoliosis may result from leg length discrepancy, hip or knee contractures, pain neuromuscular disorders, or the congenital malformations. However, it is usually idiopathic. When we talk about idiopathic, okay, this is unknown cause. Okay, evidence points to a probable genetic autosomal dominant trait with incomplete penetrance or to multifactorial causes. So that is the etiology for scoliosis. So next one is the pathophysiology. Deformity progresses during periods of growth, which is the adolescent growth spurt, and stabilizes when the vertebral growth ceases kapag nag-stop. As the spine grows and the lateral curve develops, the vertebrae rotate, causing the ribs and spine to rotate towards the convex part of the spine. Spinous processes rotate toward the concavity of the curve, and the child attempts to maintain an erect posture, resulting in compensatory curve. Vertebrae becomes wedge shape, and then vertebral discs undergo degenerative changes. When we talk about degenerative, there will be a decline or deteriorating. Muscles and ligaments either shorten and thicken or lengthen and atrophy, depending on the concavity or the convexity of the curve. A hump forms from the ribs rotating backward on the convex side of the curve. The thoracic cavity becomes asymmetrical, so hindi siya pantay, leading to severe ventilatory compensation. If the significant scoliosis goes uncorrected, respiratory function is compromised, and then the vital capacity is reduced. Di ba, isang affected na organ niya is the lungs. And also, there is a eventually pulmonary hypertension, okay, core pulmonary, and then the respiratory acidosis may develop. Okay, when we talk about the pulmonary hypertension, this is when the pressure in the blood vessel leading from the heart to the lungs is too high. Okay, for the core pulmonale naman, this is a right-sided heart failure. It is an enlargement of the right ventricles due to the high blood pressure in the lungs. It is usually caused by a chronic lung disease. And for the respiratory acidosis, there is a failure of ventilation and an accumulation of carbon dioxide. Kaya nagkakaroon ng respiratory acidosis. Okay, for the assessment findings naman, we have the clinical findings and then yung mga laboratory and diagnostic study findings. So first one, for the clinical manifestations, ano yung mga nakikita natin? Scoliosis is asymptomatic most of the time and goes unrecognized until there's some degree of deformity. Okay? The first sign of scoliosis include, we have the presence of spinal curve. Okay, ito yung liban sabi nila dito pag scoliosis, yung letter S ang spine. There is a curvature. Okay, and there is also an asymmetry of the scapula and on the extremities. Okay, so hindi siya pantay. Unusual distance between the arms and then the waist. And then for the laboratory and diagnostic study findings, okay, radiographic examinations reveals the degree and location of the curvature. For example, chest x-ray. Makikita doon kasi yung spine, yung itsura ng spine doon, mag-view din siya doon. Okay? An MRI scan, okay, mas maganda na imaging to, is used to evaluate the possibility of intraspinal pathology. Okay? Pag sinabi ng pathology, ito yung the science of the cause and effect of the disease. Okay? So, we have also types for scoliosis. Taas ko lang siya. So, first one is the functional scoliosis, and then the other one is the structural scoliosis. For the functional scoliosis, it is caused by poor posture and not by spinal disease. Okay? It is flexible and easily correctable. Pwede pa siyang maayos. Kapag structural scoliosis naman, okay, anatomical change in shape of thorax or vertebrae. Hips and shoulders are uneven, so hindi na siya pantay. Not easily correctable and may need medical interventions also. It may be a congenital. So pagkapanganak, meron na siyang scoliosis. So, under yan ng structural scoliosis. So, pwede pang makorek ang functional scoliosis than the structural scoliosis. Hindi siya madaling i-correct. And then, neuromuscular scoliosis naman, this result of weak muscles, this is result of muscle weakness or imbalance. Okay, for the treatment for the scoliosis, we have three treatments. First one is the Milwaukee brace. Okay, itaas ko siya. For the Milwaukee brace naman, this apparatus exert pressure on the chin, okay, pelvis and convex, which is nagko-curve, side of the spine. It is worn approximately 23 hours per day, and it is worn over a t-shirt to protect the skin. Indicated for curves between 20 to 40 degrees. Another treatment naman, we have the Boston brace. Okay? An underarm modification of the brace and effective for patients with low curvature. Okay? For the spinal fusion naman, indicated for curves more than 40 degrees and for patients with unsuccessful conservative treatment. Okay? We have the halo traction. It is used when there is a associated weakness or paralysis of the neck and trunk muscle. Okay, note that the curves up to 20 degrees do not require treatment. So kapag more than na doon na sila nagkakaroon ng treatment. For the nursing management for scoliosis, we have to prevent physical emotional trauma related to the wearing of a brace. Okay, first one, we should maintain the skin integrity by properly applying the braces and implementing corrective action to prevent uh, and treat the skin breakdown. So, kailangan nila ng assistive. And then also, to promote a positive self-concept. Okay, we encourage verbalization of concerns and feelings, assist the child in selecting clothing that will conceal the brace kasi baka mahihiya sila if there is an assistive device na nakalagay sa kanila. Assist the child in selecting, okay na to. And then encourage positive aspect of wearing the brace including improved posture and symptom relief. So encourage natin ano ba yung kagandahan kung bakit sila gumagamit ng braces. Okay? And then also, assist the child and family in developing the coping skills. Okay, so kailangan natin ng family support for this one. Another one is to evaluate the child's acceptance of the prescribed brace and exercise program to determine the compliance level and the need for reinforced teaching. Supplemental exercises are used to prevent atrophy. Okay, when we talk about atrophy, this is decrease in size or nagkakaroon ng wasting, muscle wasting. Okay, wasting away of a body part or tissue kapag hindi siya kasi nagagamit. Okay, or of the spinal and abdominal muscles. Another one is prevent complications related to surgery. The surgical technique consists of realignment and straighten it with a internal fixation and instrumentation combined with the bony fusion. Instrumentations include, we have the Harrington, Dwyer, Zilk, and Luke. This is to prevent neurologic deficient, okay, yan, to prevent neurologic deficit by monitoring motor. Aside from that one, sensory and neurologic status, particularly in extremities. Prompt identification of neurologic deficit and correction can prevent permanent damage. Detect impending hypoxia by monitoring the blood gas value. Okay? And notify the healthcare provider if abnormal values are detected sa patient natin. Assess for hypotension also. Okay? Decrease ang kanilang blood pressure by monitoring the INO, which is the intake and output, will most likely have indwelling Foley catheter, yung mga merong assistance para makaihi, and vital signs. And also observe the skin color to assess tissue perfusion, kapag maganda pa ba or nagkakaroon na ng sugat doon part. Okay? Maintain the skin integrity and prevent breakdown. Kasi once na nagkaroon ng breakdown yan, pwedeng pasukan na yan ng mga microorganisms, bacteria, ganyan, that which can lead to infection. Okay, promote adequate bowel and bladder elimination also. We have to prevent the constipation by assessing bowel sounds. Prevent urinary complications by providing a catheter care to prevent yung mga infections. And also promote adequate fluid and nutritional intake. Maintain the intravenous therapy until oral feedings is allowed. So, hindi pwedeng walang support ng fluid ang patient natin, lalo kapag naka-NPO siya. Promote normal growth and development, and also we have to promote the comfort. Provide the child and family with information about the scoliosis and its treatment. Include yung mga information about the equipment used during the treatment para alam nila. So, yan yung about sa scoliosis natin. So, next one, we will be tackling about the bone tumor or the osteocarcinoma. For this one, that it is a type of bone cancer that begins in the cells that form the bones. Okay, it is a primarily malignant tumor of the long bones involving rapidly growing bone tissue, which is the mesenchymal matrix forming cells. For the risk factors, okay, we have the age 10 to 15 years old, so they are risk for bone tumor. History of radiation therapy, and also if the patient is with a history of retinoblastoma. For this one, this is a rare type of cancer that develops or grows on the retina. For the manifestations, the child is usually taller than average. Okay, pain and swelling occurs at the tumor site. Sa adolescents, it is sometimes mistaken for growing pains. Okay, the area may be erythematous. This is the abnormal redness and warm to touch. And also, the child may have history of recent trauma at the site. Okay, and also another manifestation is pathophysiologic fractures. So for the treatment for bone tumor, okay, we have radical resection or the amputation surgery, puputulin kung kailangan. And then addressing the body image of the adolescent. Adolescents are very much concerned of their self-image, okay? So next one is nurse should anticipate anger. Okay, another one is grief. Alam natin kung ano, alam natin kung magagalit na ba siya, nagluluksa na ba siya, or yung takot if there will be an amputation, di ba? Ikaw ba naman hindi ka matatakot pag sasabihin na puputulin yung affected na extremity. Okay, another one is address the problems associated with phantom limb pain. Okay, this is continuous sensation of the pain even if the limb is no longer present. So ito yung problem kapag there is an amputation. Okay, for example, natanggalan na siya ng paa. And then sasabihin niya, for example, right below the right knee, pababa, natanggal na yan. Sasabihin niya, masakit yung paa ko, yung sa may masakit pa rin yung paa ko sa baba, itong right side. Kahit alam naman ninyo na wala na siyang extremity doon. So that is a phantom limb pain. Pinapaniwalaan niya na masakit pero wala naman na talagang limb doon or extremity. Okay, next one, we have the trauma and injury. For the trauma and injury, soft tissue injuries usually accompany traumatic fractures in adolescents involved in sports and adventurous activities. So we have types. We have the contusion sprain, and also strain. For the contusion, okay, contusion, which is ito yung mga bruises or pasa-pasa. Okay? Tearing of subcutaneous tissues results in hemorrhage. There is bleeding. And edema and also pain. Pamamaga and yung pain. Masakit. Okay? Hematoma is evident. For the sprain naman, this is the injuries that bands of tissue that connect two bones together. Okay? This is when ligament is torn or stretched away from the bone at the point of the trauma. They have a swelling, disability, and pain are the major signs for sprain. Okay? Basta tandaan, ang sprain is about ligament, ang strain is about muscle and tendon. Okay? Ulitin natin, sa strain natin, microscopic tear of the muscle or tendon. Kapag sprain kasi, that is ligament. Torn ng ligament. Okay? Sa strain natin, it occurs over time and results in edema. There's pagmamanas and also pain. Okay? It involves an injury to a muscle or to the band of tissue that attaches a muscle to a bone. So, that is the strain. Yun yung mga types natin sa mga injury. Okay? Prevention, we have to maintain a safe environment, educate the adolescent on safety precautions to prevent further injury, wearing of helmets and protective devices when engaging to sports and adventurous activities. Yung mga activities na which alam mo naman na there is an chance or there's a chances of tawag nito, accidents. Okay? For the treatment of soft tissue injuries, cold packs and elastic wrap reduce the edema and bleeding and relieves pain. So, nakakatulog yan. Cold compress. Okay? And then yung paggamit ng elastic wrap. Elevate also extremities above the heart level. And then elastic bandage application. Okay, for the nursing responsibility for elastic bandage application, okay, neurovascular check to ensure the adequate tissue perfusion. So, for example, sa may paa niya, di ba, na bandage yan, i-assess mo yung part na pinaka malayo. Kasi nga, titignan mo kung pumupunta pa ba, good pa ba yung circulation away dun sa malayo na extremity niya na affected. Kung okay pa ba yung circulation doon. Okay, tignan mo kung baka mamaya nangingitim na pala kasi sobrang higpit ng pagkalagay mo ng elastic bandage. Okay. Next one, we have the RISE. Okay, RISE is rest, ice, compression, and elevation. So, yun yung meaning ng RISE. Isang treatment yan for soft tissue injury. Okay, we should promote rest, apply an ice, compress, and there will be a compression, and there will be an elevation dun sa affected site. Okay, fractures in children usually are the result of trauma from motor vehicular accidents, falls, or child abuse. Because of the resilience of the soft tissue of children, fractures occur more often than soft tissue injuries. Okay? So, yan yung about sa ating injury. So, next one, we will be discussing about the STD, okay, which is a sexually transmitted disease or infection. A general name given to infectious spread through direct sexual activities. Okay, so there is walang protection during sexual activities, kaya nahahawaan. Okay, the occurrence of STI in a pre-pubertal stage must be must prompt in investigation for possible sexual abuse. Okay? Pag sinabi natin pre-pubertal stage kasi, this is before puberty. Okay? Sa puberty kasi, there will be a rapid changes in the body. Okay, for the nursing interventions, we have to review structures of reproductive system, review yung personal hygiene, discuss values and decision making, possible sexual behaviors, and also consequences, and discuss prevention of pregnancies and sexually transmitted infection. So, sa mga kabataan, di ba, maraming nagkakaroon ng sexually transmitted disease. No, madami na yan. And also, early pregnancy. So, we should also educate our patient, lalong-lalo mga teenagers. Alam naman na natin yan. Lagi sila palalabas and then the way yung mga pananamit, di ba? So, we should educate them to practice or kung talagang iwasan or abstinence for not healthy sexual activities. And then, syempre, di ba, bawal ang mga sexual intercourse unless they are married. Okay? So, we have also, next topic is amenorrhea. Okay, amenorrhea, this is refers to the absence of menses, di ba? A is absence, menorrhea is menarche, di ba? Menses. Okay? Primary amenorrhea, we have primary and secondary. So, when we talk about primary amenorrhea, it is when no menses occur by the age of 17. Okay? Wala talaga siyang mens. Yan yung primary. Pero pag sinabi nating secondary amenorrhea, it implies that menses have been established but have ceased for a minimum of 3 months. So there is that yun yung sinasabi natin or what we call the secondary amenorrhea. Nag-mens naman siya but nag-stop na siya. Ang pinaka-minimum niya is 3 months na hindi siya nagme-mens. So that is secondary amenorrhea. Okay, we have the causes also of amenorrhea. Corpus luteum cyst. This is a normal, harmless, fluid-filled mass that forms in the ovaries. And also, bakit nagkakaroon ng amenorrhea? Maybe the cause of lactation. Okay? Yung pagpapadede ng mga after ng anak. Okay? Menopause or premature or normal. Hypothyroidism and then the hyperthyroidism, they can be a cause or symptom of amenorrhea to them. Yung mga nagki-chemotherapy, ano pa, yung may PCOS, di ba, hindi sila nagme-meds. Next one is diabetes mellitus. Isang symptom din nila yan. And there is yung mga stress, okay, nagkakaroon sila ng amenorrhea. Isang cause din ang stress for amenorrhea. And also excessive exercises and weight loss and also pregnancy, di ba? Sa pregnancy, hindi ka naman pwedeng mag-mens kasi buntis ka nga. Okay, pregnancy must always be considered as a cause of secondary amenorrhea. Bakit secondary? Kasi nga nagme-mens naman siya before siya nagbuntis. Okay? Even if the patient denies sexual contact. Okay. For the etiology, we have primary amenorrhea include agenesis, which is the no formation of the uterus, the Turner syndrome, which is the genetic disorder with pectus excavatus. Okay, when we talk about Turner syndrome, this is a chromosomal condition. One X chromosomes, which is the sex hormone, is missing or partially missing. Okay, for the pectus excavatum naman, this is the depression of the sternum. Yun yung paloob yung sa may chest niya, sa may sternum niya, pumaloob. Okay? And then there is also a heart murmur and short stature. And also there is an imperforate hymen, wala siyang butas. And constitutional delay. For the certain medications naman that can cause amenorrhea, okay, including chemotherapy and then the medroxyprogesterone acetate, which is the Depo-Provera, which is given as a contraceptive injections. Okay, isang medication to for contraceptions para hindi ka mabuntis, yung Depo. So, yan yung mga etiology bakit nagkakaroon ng amenorrhea. Okay, we have the signs and symptoms. For the primary amenorrhea, the patient may exhibit abnormalities in the body habitus suggestive of delayed puberty. The Tanner stages of sexual characteristic development may show delays. Okay, for the secondary amenorrhea, signs and symptoms of pregnancy include mastalgia. This is the breast tenderness, breast enlargement, nausea and possibly vomiting, especially in the early morning, gastrointestinal upset, and there is a urinary frequency. On examination, the uterus may be enlarged and Chadwick's sign, ito yung blue or the violaceous cervix may be present, a probable sign of pregnancy that becomes evident about the 4th week of gestation. For the hypothyroidism, the patient may have dry skin, dry hair, fatigue, hoarseness, constipation, and an enlarged thyroid gland. Sa hyperthyroidism naman, okay, the patient may exhibit oily skin and hair, diaphoresis. There is also a tachycardia, diarrhea, and also goiter. Yun yung enlargement of the thyroid gland. Yun yung mga symptoms natin. Sa patients naman with a polycystic ovarian syndrome, may have hirsutism. Ito yung mga excessive facial and bodily hair, and also obesity. For the corpus luteum cyst, tend to cause pain in the lower quadrants that may be intermittent in nature, as some cysts resolve spontaneously. Okay, other cysts grow and may rupture, causing significant lower quadrant abdominal pain and even peritoneal signs of rebound and guarding and rigidity. So, yan yung mga signs and symptoms natin for primary amenorrhea and secondary amenorrhea. For the diagnosis natin, we have genetic testing. This is to determine the disorders such as the Turner syndrome. And yung Turner syndrome, di ba sabi natin kanina, Yun yung chromosomal condition, which is one X chromosome or the sex hormone is missing or partially missing. Okay? We have the pelvic ultrasound or the transvaginal. This is the ultrasound one in the vaginal canal. Okay, ito yung nagpapasok sila ng ultrasound dun sa may vagina, trans V, okay? It is used to test for pregnancy, ovarian cysts, and other gynecological abnormalities. Okay, ginagamit to kapag hindi pa nakikita sa abdominal ultrasound ang baby. So, para malaman mo yung weeks ng baby, lalong-lalo kapag bago pa lang, okay, para malaman mo yung exact weeks, gumagamit sila ng transvaginal ultrasound. Okay, so yan yung sa ating amenorrhea. Hindi naman pregnancy ang nakikita dyan, yung mga about diseases din also. Kapag may mga tumor na nakikita, mga cyst, and kapag may mga other gynecological problems or abnormalities. Okay? Next one is the dysmenorrhea. For the dysmenorrhea, this is a painful menses or cramps. Okay? There is a discomfort in the lower abdomen and may radiate to the lower back or down the legs and may be accompanied by nausea and vomiting. Okay, for the types, we have the primary and secondary. For the primary, okay, there is no evidence of pelvic abnormality. It affects 50% of menstruating females, and it is the leading cause of short-term recurrent school absenteeism in adolescent girls. Okay, ito yung mostly nagiging problem ng absent nila kapag nag-aaral na sila, the dysmenorrhea, because it is very painful. Okay, sa primary din natin, the menstrual cramps that come back every time you have get period but aren't due to another medical condition. So every magme-mens ka lang, doon siya sumasakit. So that is the primary. For the secondary naman, it is a pathologic condition is identified. Okay? They have a painful period because of a condition or an infection in your reproductive organs. Hindi yung every magme-mens ka, hindi yon. Sa primary yon. Okay, so kapag secondary, there is an presence of disorder or illness. Sa manifestations natin, onset is shortly after menarche. When we talk about menarche, this is the first menstrual period. Ito yung pinakaunang menstruation with heavy menstrual flow. Pain starts no more than a few hours before menstruation and starts and lasts for no more than 72 hours. Okay, for the pelvic exam naman, the results are normal. So this is a primary. Secondary dysmenorrhea. This is most commonly results from endometriosis. Okay, when we talk about endometriosis, it is a disease in which tissue similar to the lining of the uterus grows outside the uterus. It can cause severe pain in the pelvis and make it harder to get pregnant. So yan yung manifestations for primary and secondary din natin. Okay, for the treatments, for the prostaglandin inhibitor drugs, okay, such as yung mga ibuprofen and naproxen. Okay, kapag sabi nating prostaglandin inhibitor, it decreases the uterine contractions by inhibiting the activity, okay, of the cyclooxygenase enzyme that converts arachidonic acid to the various prostaglandins. Okay, itong mga ibuprofen and naproxen natin, they reduce uterine hypercontractility, pressure, and ischemia and pain. So, yun yung mga treatments natin. Another one is heat application. Okay, hot compress to the lower abdomen or sa back to relieve the pain. Another one is the oral contraceptives, which reduce the amount of endometrium built up each month and therefore reduce the prostaglandin secretions. Okay, we have also diet for dysmenorrhea, low fat and vegetarian diet. It was shown to increase serum concentration of sex hormones, binding globulin, and reduce dysmenorrhea symptoms. Itong diet na to, low fat and vegetarian diet. Okay, another one is vitamin B and E and high levels of omega-3 fatty acids. Okay, bakit ba inaalaw natin ng vitamin B and E? Because this help prevent severe pain. Okay? Bakit naman omega-3 fatty acids? Because it has a natural anti-inflammatory action that can relieve yung mga menstrual pain. So, yun yung mga pwedeng supplementation and then yung specific diet kapag nagkakaroon ng dysmenorrhea. Okay. Next one is obesity. For the obesity naman, this is the excessive weight in childhood, okay? Is related to obesity in adulthood. It can lead to increased cholesterol, orthopedic problems, so may mga problems na sila sa mga bones nila, and sleep apnea. Okay, kapag natutulog, there is association of breathing, and high blood pressure also, and syempre diabetes. Okay, the mga obesity, it can lead to high blood pressure and diabetes. It can lead also to social isolation, which may lead to depression, lalo kapag ka-obese ka, walang gusto makipagkaibigan sa'yo, so anong gagawin mo na lang, magmumukmuk ka, ayaw mo na magkipagkaibigan. Okay? BMI, 22 to 24 in adolescents, it indicates obesity. Okay? Sa adolescent natin, hindi siya pantay kasi nga teenage years to, hindi ito yung normal na BMI nila. So, for the nursing interventions, anong gagawin natin? We have to monitor weight regularly para ma-monitor natin kung pataas ba or pababa. And then counseling on diet and lifestyle. Okay, for example, matakaw siyang kumain. So we should counsel our patient and health educate our patient kung ano yung kailangan niyang gawin, ano yung mga ililimit niya, ano yung mga babawasan niya. Okay? And also, aside from diet kasi, partneran din kasi natin yan ng exercise. So we should encourage exercise sa mga adolescent natin. Another one is yung mga eating disorders naman. Okay, for the eating disorders, we have anorexia nervosa. Okay, anorexia nervosa and then bulimia nervosa. Pag sinabi nating anorexia nervosa, okay, nagkakaroon sila ng purging. Okay, pinapurge nila. And then, nagpo-purge yung nilalabas yung kinakain nila or withholding. Ibig sabihin, hindi na lang sila kakain. Okay, another one is the bulimia nervosa. Okay, nagbi-binge eating sila. And then, binge eating yan, kain sila ng kain. Pero, after that, magpo-purge naman sila para lumabas yung mga kinain nila. So, that is an eating disorders. It is also a form of self-starvation. Gugutumin talaga nila yung sarili nila. Seen mostly in mga adolescent girls. Bakit adolescent girls? Okay? Adolescent girls, ba teenagers yan? At napakano nila yan sa body image. Malaki ang pagtingin nila sa body image pag sexy ka kapag teenager ka. Okay? And also, adolescents with anorexia nervosa usually lose up 85% of ideal body weight. So, ang laki. By either restricting food, hindi sila kakain, or calorie intake, or by consuming calorie intake but then purging by vomiting or vigorous physical activity. Okay, kakain nga sila pero mag-exercise naman sila, di ba, maboburn din naman yun. Tapos, doon din napupunta or ano naman, sinusukan nila. Okay? For the characteristics, we have failure to maintain minimum body weight for age and height, an intense fear of gaining weight, takot sila, excess influence of body weight upon evaluation, and there is also an amenorrhea. Okay? Hindi sila nagme-mens kasi hindi naman din proper yung nutrition ng patient with eating disorders. For the risk factors naman, we have genetics and also average to superior intelligence and overachievers, usually yung mga perfectionist. And then yung mga meron dysfunctional family, controlling, okay, rigid and imposing ang mga family members. Okay, they are risk for eating disorders. Another one is social standards of weight such as being thinner. Okay? For the diagnosis for this one, for anorexia nervosa, can be challenging and based on both physical and emotional signs and symptoms. Okay? Adolescents with the disorder are below their ideal body weight and are often preoccupied with food. Okay, so preoccupied sila sa pagkain. During an interview, the adolescent may express that he or she refuses to eat or consume very large amount of calories and then purges by self-induced vomiting. So, ilalabas na yan through, magpa-purge siya para magsuka. And, or using a laxative, yung mga pampatae or the other means, kung ano pa yung gagawin nilang way para matanggal yung mga kinain nila. Okay? For the manifestations, ano yung mga makikita natin kapag there is an eating disorder? So, we have weight loss. Siyempre, weight loss yan. Kasi nga, takot nga silang lumaki. Kapag kumain man sila, ilalabas din nila. Okay, another one, we have weakness. Okay, there is a body weakness kasi walang lakas yung katawan nila ng mga galing sa food nutrients, okay? Fatigue, madaling mapagod. Dry skin, okay? Dry skin, amenorrhea, absence of menstruation, lanugo hair over back and extremities, cold intolerance, hindi nila kaya ang lamig, low blood pressure, abdominal pain, constipation also, hirap silang tumae, helplessness, lack of control, low ang kanilang self-esteem, ano pa, there will be a presence of depression, and then lack of self-identity. Okay, although eating less, anorexic patients are preoccupied. Okay, pag preoccupied, di ba ito yung nagtithink or worrying about something. Okay, they are worrying or thinking about food, but hunger is denied. Okay, preoccupied sila sa pagkain, pero yung gutom nila, dinedenay nila. Okay, they also feel bloated when ingesting even small amount of food. Feeling nila busog na sila kahit isang kutsara pa lang ang kinakain nila because of their fear na lalaki sila agad-agad. Okay, for the clinical alert, anorexia nervosa can become a life-threatening problem or cause death because of severe weight loss. Okay, that can cause in electrolyte imbalance. Okay, electrolyte imbalance kasi nga ang mga electrolyte sources natin, di ba, sa foods din, mga supplementation galing sa mga food. And then, nilalabas pa nila, nagpo-purge pa sila, nilalabas. So, yung mga electrolytes, lumalabas din. Okay, so nagkukulangan ng katawan nila. And hemodynamic instability. So, yun yung mga i-watch out natin for anorexia nervosa. For the treatment, okay, there will be a brief period of hospitalization may be necessary to correct severe malnutrition and electrolyte imbalance. Another one is stabilize of the patient's weight, okay, individual and family psychotherapy also, antidepressants medication as ordered, and also there will be a provide comfortable and relaxed uh, atmosphere. And also, adolescents with bulimia nervosa may need dental care for repair or dental erosion and cavities that results from vomiting. So, yung lagi nilang pagba-vomit, pagba-purge, pagba-vomit, pwede din magkaroon ng dental problems. Okay? So, there will be a need for dental care. Okay, so that is the eating disorders about the anorexia nervosa and then the bulimia. So next one is the substance and alcohol abuse. Okay, for this one, it is known that 80% of death in adolescent involves accidents, okay, homicides, ano pa, suicide, and in many cases, these cases, drugs and alcohol are involved. Okay? For the assessment, we have the substance abuse. Substance abuse refers to the repeated use of illicit substances. We have the drugs or alcohol or yung mga inhalants despite the negative consequences na pwede niyang ibigay or gawing problem sa katawan. This may lead to tolerance, withdrawal, and compulsive drug taking behavior kapag tuloy-tuloy pa rin hindi nila i-stop yung kanilang abusive about the substances or alcohol. Okay? And then, substance dependence, addiction, refers to psychological and or emotional reliance on that substance. Takes in larger amounts and over long period of time. And then, daily activities revolve around use of substances. So, that is yung mga assessment natin for substance abuse. Sa alcohol abuse naman, the physical and psychological dependence sa alcohol. Another one is the physical symptoms. They have a slurred speech, unsteady gait because of that alcohol. Okay, nagkakaroon ng problem sa kanilang speech and then sa paglakad nila. Okay, psychological symptoms, we have depression, hostility, where hostility, ito yung mga unfriendliness, okay, ayaw nila maghihalubilo, suspiciousness also. So, yan yung mga assessment natin for alcohol abuse. So, for the assessment finding, okay, we have the, ito yung mga warning signs that a young person might be abusing alcohol or drugs. For the physical, we have the assessment here is fatigue, repeated health complaints, red and glazed eyes, and a lasting cough. So, yan yung mga nakikita nating signs for physical. Sa emotional naman, personality change, sudden mood changes, nagbabago-bago yung mood nila, irritability, okay, irresponsible behavior, low self-esteem, They have also a poor judgment and depression also. There is a presence of depression and yung general lack of interest. Okay, for the family naman, okay, sa family, okay, starting arguments, there will be also a breaking rules to the family and withdrawing from the family. Okay, lumalayo sila sa family members nila. And also sa school naman, there is a decreased interest sa school nila, negative attitude toward others, drop in grades, okay, nando-drop na sila because of yung mga many absences, and truancy, which is absenteeism, and also discipline problems. Another assessment findings is social problems. Okay, new friends who are less interested in standard home and school activities, problems with the law, and changes to less convenient, conventional styles or of dress and the music. So ito yung mga mapapansin natin mga warning signs sa mga young person kapag there is an abusive of drugs or alcohol. Okay, we have also complications. We have the delirium tremens and alcohol syndrome. For the delirium tremens, this is a psychotic condition typically of withdrawal in chronic alcoholism involving there is a presence of tremors. Ito yung rhythmic shaking, for example, sa hand, tremors sa hand. Okay, yung gumagalaw-galaw ng kusa, rhythmic shaking. Hallucinations, okay? Depende kung anong hallucinations, nakakarinig sila, nakakakita sila na hindi natin nakikita na mga normal. Okay, and also anxiety, and also disorientation. Okay? Sa Korsakoff naman, psychosis, sa complications ng ating substance and alcohol abuse, sa Korsakoff psychosis, this is a memory disorder that results from vitamin B1 deficiency and it is associated with alcoholism. For the Wernicke syndrome naman, this is a type of brain injury that mostly happen to people who drink a lot of alcohol. Okay, another complications, the peripheral neuropathies. This involves a damage to the peripheral nervous system. Example natin yung numbness and tingling in the feet or hands. Okay? Hepatitis naman, cirrhosis and pancreatitis also. Hepatitis, inflammation of the liver. Cirrhosis, there is a severe scarring of the liver. And pancreatitis, inflammation of the pancreas. And another complication is the anemia. Ito yung decrease in number of healthy red blood cells. Okay, we have stage 1, stage 2, stage 3, and stage 4. Stage 1, there is an anxiety, okay, anorexia, an eating disorder, insomnia, hirap silang matulog, mild tremors, yung mga rhythmic shaking, okay, hyper-alertness, internal shaking, nausea and vomiting. There's also an headache and increased pulse and increased ang blood pressure. So, yan yung mga makikita sa stage 1. Sa stage 2 naman, okay, there is a profound confusion, okay, there is a gross tremors, nervousness, also disorientation, nag-illusion na rin sila, auditory and visual hallucinations meron na rin, and also nightmare. So that is stage 2. Okay? For the stage 3 naman, severe hallucinations. So hindi na siya yung mga complications niya, iba na. Yung mga naririnig, nakikita, okay? Madami na siyang other senses na wala namang nakikita or naririnig. Okay, stage 4 naman, there is a delirium. Pag sinabi natin delirium, this is a disturbed state of mind or consciousness. Another one na kasama sa stage 4 natin, uncontrolled tachycardia. Okay, visual and tactile hallucination. So, nakakakita or yung feeling nila may nagtatouch sa kanila na wala naman. Okay? That is a tactile hallucination. For example, may spider na gumagapang sa kamay ko, tingnan mo wala namang spider. So, tactile yon, nararamdaman nila. There is also a fever, severe psychomotor activity, agitation, and restlessness. Okay, for the diagnosis of a substance abuse and abuse use is based on the physical, emotional, and social factors exhibited by the child. A thorough family history is essential along with information about the child's physical and emotional health. So we have a nursing care here. Okay? Assess the drug and alcohol use in children, kung ano yung ginagamit. And then the nurse is an ideal position to identify adolescent at risk for substance abuse. Okay? Especially if there is a strong family and genetic history of abuse. Two tool can be used in the identification of substance abuse or we have the craft, okay? And also yung cage. Both of these tools use simple acronyms to assist in the evaluation of drinking or the drug use. Sa meaning ng craft, yung acronym na craft is we have the car, relax, alone, forget, friends, and trouble. So that is the craft evaluation tool. For the cage naman, that is cut, kay cat na parang sinugatan, CUT, kay cat, annoyed, guilty, and I. Okay, so yan yung meaning naman ng cage natin na assessment tool. Okay, another one, na nursing care, we have to help the child and family find community resources. Okay, para saan? Para matulungan yung bata at saka din yung family members. Okay, this may help conquer the substance abuse problem. Research indicates that nearly 80% of adolescents with substance abuse receive treatment. These are mainly different types of treatment, but the most promising appears to be a family-based approach as it shows the best outcomes for the reduction of the substance abuse in the adolescents. Okay, family treatment means that the entire family receives psychoeducational regarding substance abuse. So, hindi lang yung patient ang involved dito. Okay, kasama din sa ang mga family members. Okay? So, yan yung ating substance abuse and alcohol use. So, next one, we have the suicide. For the suicide, it is a deliberate or self-injury with the intent to end one's life. Okay, magpapakamatay. Suicide is more successful in males than in women. Pero, ang more attempts is mga girls kaysa sa mga lalaki. Pero mga nagsa-successful na nagpapakamatay mga lalaki. Okay? Most often happens during school year for kapag mga pressure sa school, pressure from the family na dapat ganito ka sa school, okay? Reflecting school stress and between the time of 3 p.m. and midnight, okay? Which reflects depression that increases with the dark. Okay, ranks third as the cause of death in the age group of 15 years old to 19 years old, ang suicide. Okay, for the etiology of suicide, the common stress of adolescence, okay, compounded by limited problem-solving abilities, sometimes led to harmful and also life-threatening behaviors. Okay, adolescents who are depressed, psychotic, or substance abusers are the higher risk na gagawa ng suicide. Okay, for the common contributing factors, we have the past history factors, which include the previous history or the previous suicide attempts, family members or friends who has made an attempt. So, part yan ng past history, which can be a factor that can lead to suicide. Okay, ano pa? Child abuse. Nung kabataan niya, okay, na-felt niya ang child abuse. And also, death of a parent when the child was young. Okay, maaga siyang naulila. Another factor, we have the family factors. This include conflict, parental rejection or hostility, okay, divorce and separation, ano pa, relocation, paglipat-lipat sa kanilang, pag nakasanayan niya, nalilipat na naman. Okay, unrealistic parental expectations, and also parental indifferences. So, yan yung mga factors part ng family. Another one is the adolescent factors. Okay, it includes hopelessness, okay, depression, substance abuse, impulsivity, and also a difficulty tolerating frustrations, and the mga feelings of self-loathing. Okay, this is a constant belief or feeling of worthlessness or feeling niya failure siya. Okay, this is sa guilt. Okay, also thought of disorder, physical or body image problems, gender identity concepts, and a perfectionist personality. So, kabilang lahat yan sa adolescent factors which causes the suicide. Okay, another one, we have the socio-environmental factors. It includes access to firearms, isolation, ineffective support system, which is another one is incarnation. Ito yung parang incarceration, meaning imprisonment, pagkakakulong. Okay? Limited social, educational or vocational opportunities and exposure to suicide of others. So, Kapag once na na-expose ka sa suicide ng ibang tao, okay, lagi mo nang iisipin yun, maging stressor sa'yo yun, isang factor yan ng socio-environmental factors that which can lead to suicide also. Okay, causes of depression. For the causes of depression, we have anger. Bakit ba nagkakaroon ng depression? Okay, anger. Ano pa? Manipulation. For example, psychological blackmail. Okay, na manipulate. Okay? It can lead to depression. Loss of a parent. Okay, lalo kapag maagang nawalan ng parents, bot pa, 'di ba? Nagsabay, mga ganyan. It can cause a depression. Ano pa? Loss of a girlfriend or a boyfriend, lalo pag mahal na mahal mo, iniwan ka. Siya na ang buhay ko kasi, gano'n, no, 'di ba? Naging cause na ng depression. Ano pa? Loss of a community. Okay? What else? Loss of self-esteem. Okay? Tiwala mo sa sarili mo. Okay? We have also assessment. Okay? Adolescents need to have thorough physical examination at the health maintenance visits to assure them they are in good physical health. Okay? Depression usually precedes suicide. So, kapag hindi na-recover ang depression, pwede siyang itutuloy niya na magpapakamatay. Okay? Signs of depression may be overt or subtle. Pag sinabi natin overt, okay, pinapakita, shown openly. Okay, kapag ka-subtle naman, subtle, this is difficult to understand or perceive. Hindi mo akalain magpapakamatay. So, depende kung ipapakita niya or hindi yung mga symptoms. Okay? We have lethargy and malaise. Okay, lethargy, ito yung lack of energy or enthusiasm. Okay, another one is malaise. This is a general feeling of discomfort or illness. Okay, another one, anorexia or overeating. Ito yung mga signs and symptoms. Another one, weight loss. Ay, wala na siyang ganang kumain. Nangangayayat na siya. Insomnia, hindi na siya makatulog. Okay? Excessive fatigue. Okay? Madali na siyang mapagod. For example, kapag hindi na siya natutulog, di madali na din siyang mapagod, di pa siya kumakain. Okay? Excessive crying. Di ba? Lagi yan. Depression yan. Kapag hindi siya maka-overcome, matagal lang nangyari pero umiiyak-iyak pa rin. Okay? Giving away cherished possessions. Okay? For example, favorite mo, tapos bigla mong binigay. Okay? Hindi ka na magtataka, favorite mo to, tapos binigay mo. So, pwedeng maging overt sign yan, which is pinapakita niya, sino-shown openly niya, na nagle-let go na siya ng mga important things niya. So, next one is preoccupation with death or death themes. For example, sa music, sa arts, sa movies with death themes. Okay? Statement of intention to commit suicide. Nagsasabi ka na magpapakamatay ako. Okay, kapag babae yan, kahit ulit-ulitin pa yan, di ba mas prone ang lalaki nagtutuloy. Once na lalaki nagsabi dyan, kailangan mo nang kausapin yan kasi baka itutuloy niya talaga. Okay? In younger adults, okay, depression can be manifested by behavior problems. We have the disobedience, temper tantrums. This is very unpleasant or disruptive behaviors and also emotional outbursts. Okay? Truancy, absenteeism yan. Running away from home, self-destructive behavior. Okay, naglalaslas ka na. Another one, accident proneness, difficulty in school. Ano pa? Acting out with the chemicals, alcohol, or sexual promiscuity. Ito yung madaming many sexual partners. And also trouble with legal authorities. So, yan yung mga manifestation, behavioral problems for depression. Okay? Occasionally, depressed adolescents find it so hard to be alone and they seek constant activity as a means of escape. Other may withdraw from contact with the other person and become completely isolated. Nagkukulong na lang sila. Okay, we have the adolescents who attempt suicide fall into many categories. First one, loners and those who have difficulty expressing their feelings to others, therefore do not receive emotional support from friends. So sila yung mga nag-attempt to nagfo-fall to attempt suicide, okay? Another one is students who are trying to continually become an achiever. Okay? Kapag once na bumagsak yan or isang ano lang, may chance yan na magiging made-depress and then pwede siyang magkaano ng suicide. Okay? Ano pa? Gay and lesbian youth. Okay? Isang ano din to, category. Adolescent who have a family member or close friends who commit suicide. Ano pa? An adolescent who have a schoolmate who committed suicide. And then, students who have internet contacts who arrange a group suicide. So, yun yung mga categories for adolescents who attempt suicide fall. Okay? Next one, we have the suicide warning signs. Ano yung mga warning signs natin? Giving away prized possession. Yung sabi nga kanina, napaka-importante sa'yo, bakit ibibigay mo? Okay? Organ donation. Questions such as, how do you leave your body to a medical school? Okay, pansinin natin itong mga warning signs na to. Baka ito na yung mga pinapakita nilang signs na magpapakamatay sila. Another one is sudden, unexplained elevation of mood. Mood elevation may indicate that the individual has reached a decision about a suicide and feels relief. Baka nakapag-isip na siya ng final decision niya na itutuloy niya na. Okay, another one, accident proneness, carelessness, and death wishes. Okay, next, a statement such as, this is the last time you will see me. Okay, another one, decrease in verbal communication, ayaw nang makipagsalita. Okay, withdrawal of peer activities or previously enjoyed events, lumalayo na siya. Another one is previous attempt. 80% of all completed suicides have been preceded by a failed attempts. Okay? Preference of art, for art, music, and literature with themes of death. So, yun yung mga signs din natin. Recent increase in interpersonal conflicts with significant others. Like the family members, friends, ganyan. Running away from home. Ano pa? Recent activities of a friend or a famous person committing suicide. Okay? And then inquiring about the hereafter. Ito yung life after death. Okay? Ano pa? Asking for information supposedly for a friend about suicide prevention and intervention. And lastly, isa warning sign, almost any sustained deviation from the normal pattern of behavior. So, yun yung mga iwa-watch out natin na mga warning signs to prevent the suicide attempt ng mga client or patient. Okay, for the nursing diagnosis, we have risk for violence, okay, self-directed, related to symptoms of depression, or expressed desire to hurt oneself. Okay, another one is ineffective coping system. Pag hindi niya talaga kaya maba or ineffective ang kanyang coping system, magtutuloy at magtutuloy yan. Hindi niya kayang labanan. Hopelessness, wala nang kapag-asa. Okay, altered family processes. So, yan yung mga nursing diagnosis natin for suicide. Okay, for the planning and outcome identification, an adolescent who has made suicide gesture attempts will display improved self-esteem. Another one, positive behaviors and more efficient coping problem-solving strategies. Ano pa yung mga planning? Family and friends of adolescent who committed or completed suicide will work through their grief and resolve the loss over time. So, yun yung planning and outcome identification natin. For the implementation naman, okay, assist the adolescent in alleviating feelings of helplessness and hopelessness. We have to provide information for teachers, parents, and adolescents about the risk factors. Okay, counseling available to adolescents and stress-reducing and problem-solving strategies. Another one, provide a crisis intervention for an adolescent who gestures or attempts suicide and plan for family follow-up care. Ensure that the adolescent understands that he or she must cease, care, or stop or not implement this destructive behavior. Another one, arrange for counseling and hospitalization if necessary. Refer the adolescent and family to a professional therapist who will work with them through the crisis. Okay? Kung may kailangan nilang nakausap, may i-refer yan. Okay? Another one is assist the family and friends in coping with the loss. After a completed suicide occurs, counsel the adolescent's family, yung mga naiwanan and friends to help them understand work through their grief. Paano sila makaka-overcome dun sa loss. Okay? We have other interventions. Okay, client expresses feelings of depression to healthcare providers or the adults. Okay, saying she will contact support person should the desire to commit suicide become overwhelming. Intervention for adolescents who are contemplating suicide includes trying to alleviate their pain and depression and counseling them to help them change their perceptive on the value of life. Okay, another intervention, try to find out the things in the child's life that are still viewed as important. And since adolescent resort to suicide as a method of solving their problems, helping them in this area can be an interventional or intervention strategy. Okay, help adolescents speak honestly about thoughts of suicide and the problems that have led them to think that that is the solution. Okay, tulungan natin sila, baka pwede silang mag-share. People or a period of observation in a hospital setting is desirable after a suicide attempt to prevent the adolescent from inflicting personal injury. Again, okay, pagsasaktan niya din sa sarili niya, and to allow assessment in a neutral setting away from the stress and precipitated the attempt. Okay, another one is antidepressant medication alone may be of little value in treating depressed adolescents. Continuing evaluation by both history taking and physical examination is necessary. Okay? Because the young people or person who has attempted suicide may attempt it again if support people and better problem solving ability are not available at another time. Okay? So, dapat maagapan agad. Okay? We have also concerns for the adolescents and family with unique needs. Okay? Achieving a sense of identity may be difficult for adolescents who have a chronic illness or other challenges. It is also important for such individuals to learn to look past their particular condition to their real selves. Okay? And also, some of the biggest problems of chronically ill adolescents are likely to be difficulties in being as independent as they would like to be, and also achieving in school, yung mga biggest problems nila, yung mga may mga sakit, and also establishing intimate relationship. Okay? The loss of many hours of school because of illness or frequent hospitalization may result in the inability to pursue a desired career, and or at least without a delay. Okay, chronic hospitalization or the realization they will never be free from symptoms can cause depression in adolescents, and also placing them at high risk substance abuse or suicide. So ito yung mga concerns natin for adolescents and then the family. Mga kailangan nilang i-ano. Okay, we have the outcome evaluation. The adolescents demonstrates improved self-esteem, positive behaviors, and more effective coping and problem-solving strategies. And also, other evaluation natin is if a completed suicide occurs, the family and friends work through their grief and resolve the loss over time. So that is all about the suicide. Thank you.